Just tell me what to eat. So often, I have so many of my patients asking me, please just tell me what to eat in order to lose weight. And the thing is, I don't do that. And so why is that? Well, it's multifactorial. So many of my patients come from different cultural backgrounds, different socioeconomic status, or have different food intolerances or allergies. So telling them all to eat the same thing would be ridiculous. But in addition, telling you to go on a diet, I know doesn't work. So when we put people on diets, their brain views this as a short-term quick fix that is temporary before we go back to eating normally. And the issue with our North American way of eating is that eating normally is often what led us to gaining weight in the first place, because our way of eating in North America is very high in refined carbohydrates, processed foods, sugars, and high-calorie foods. So putting someone on a diet where they view it as a quick fix for a few months, then going back to eating normally is really not serving them. But that said, a lot of my patients would benefit from learning about the different ways of eating that are out there, so let's go over them. And quite frankly, if one of them fits for you and is beneficial, that's great. So to start, by far the most common one that we all know about is a low-calorie diet. And on average, this evens out to about 800 to 1,500 calories per day. But even going a step further from that is the very low-calorie diet, or VLCD, which is less than 800 calories per day. And we don't actually recommend you do this without medical supervision because it's very restrictive and can have medical complications. So this can actually cause issues with skin changes, nail changes, hair changes, gout, mood issues, gallstones, and even cardiac arrhythmias. And despite the fact that it's so restrictive and it can even have these health complications, it's not actually been shown to be superior in terms of weight loss compared to just a low-calorie diet. So it really doesn't seem worth it to restrict yourself to that degree with those risks to not get extra weight loss. The next one we've all heard of is low fat. So this usually consists of about 20 to 30% of your caloric intake being fat, with less than 10% of that being saturated fat. And if you're worried about your cholesterol, this way of eating can be beneficial for you in that it reduces your total cholesterol and your LDL, which is that bad cholesterol. However, it's important to note that the American Heart Association and the American Diabetes Association does not recommend substituting out saturated fats with refined carbohydrates because that actually increases your risk of cardiovascular disease. And I think we all learned in the 1990s, when this was such a fad, that if low fat was the be-all and end-all, we wouldn't be where we are today because it doesn't seem to be superior to other ways of eating in terms of weight loss. And again, another one that is often on our minds is the low-carb way of eating. And there's many different variations of this, but basically, on average, we're talking about less than 50 grams a day of carbohydrates, and really trying to eliminate those processed, refined carbohydrates. And aside from weight loss, this way of eating actually reduces insulin secretion and improves glucose control, which is beneficial for a lot of my patients with diabetes. And for weight loss, it actually can suppress ghrelin release. So ghrelin is that hormone that makes you hungry. And so as you lose weight, normally that increases. But for some reason with low carb, that is blunted. So you are able to continue to lose weight without feeling hungrier all the time. And your metabolism doesn't seem to slow down as much. In addition, this way of eating can also reduce triglycerides and raise HDL, which is that good cholesterol, more than low-fat diets. Now, one that we often don't really talk about so much anymore is meal replacements. So these can be, oftentimes we're talking about protein shakes, and we do know that replacing 2 meals a day, usually it's breakfast and lunch, with a isocaloric or energy consistent meal, such as a shake, can actually cause weight loss. And it's really interesting because this can actually be the exact same number of calories as a conventional food diet, but it still helps you lose weight. And for weight loss maintenance, this can be achieved with just one meal replacement per day. And while it can seem pretty restrictive, I actually find patients who follow this way of eating, they actually find it really freeing because they're able to travel with them. They can just have a shake breakfast and then lunch and then a regular supper, and it just kind of simplifies things. So if it works for you and you find that an easy fit for you, the data actually suggests that it does work. Another hot topic nowadays is intermittent fasting. So again, many different forms of this. It can involve one day on, one day off, days of the week where you only have about 25% of your calories, or even time-restricted eating, or TRE, where you eat during a specified window of the day. Oftentimes it'll be 16-8, so maybe you fast for 16 hours and then eat for 8 hours, or 20 and 4, where you fast for 20 hours and eat for 4. And on average, this leads to about a 7 to 11 pound weight loss over a 10-week period, but the studies and data are a little bit mixed in terms of superiority for weight loss compared to other plans. But again, if it works for you and you find it convenient and easy, great. In terms of vegetarianism or veganism, again, many variations, but there are ways to still consume protein, such as soy, legumes, nuts, seeds, and dairy if you're not vegan. The benefits of this way of eating can involve a lower LDL, which is that bad cholesterol, and decreased risk of cardiovascular mortality, in addition to decreased risk of certain cancers and diabetes. And if animal protein is not replaced with refined carbohydrates, again, this can help with weight loss. The second to last diet we'll talk about is the Mediterranean way of eating. So this is what is considered a moderate fat way of eating or diet, and it really relies heavily on healthy fats. So omega-3s, which usually include extra virgin olive oil. So this diet is high in whole grains, fruits, veggies, legumes, nuts, fish, and moderate alcohol consumption, while reducing dairy, poultry, and red meat. And this is absolutely the way of eating if you're worried about heart disease or developing diabetes. In fact, one study showed that the Mediterranean diet reduced the risk of your first cardiovascular event by 30%, and the risk of you developing diabetes by 40%. In terms of weight loss, over 2 years, patients lose on average between 4 to 5 kilograms. The last one we'll talk about is glycemic index. So I think we've heard about low GI or low glycemic index. So glycemic index basically reflects how much and how fast a food increases the amount of glucose in your blood. So high GI foods increase blood glucose faster than low GI ones. And foods are scored on a scale from 1 to 100 relative to a standard of glucose itself. And many things can impact glycemic index, such as ripeness of fruits, how long you cook your pasta, and other foods that you eat in addition to the food at the same time. But interestingly, with regards to weight loss, studies have shown that a low glycemic index and high protein diet is one of the best approaches for maintenance of weight loss long term. So that all said, having gone over everything we talked about, what do I tell my patients? So my take-home messages are these. Let's increase vegetable intake, eat protein at every single meal, reduce refined and processed carbohydrates, eliminate or reduce sugar, including liquid sugar, which is pop, juice, and sugar in your coffee and tea. And remember that What works for one person in their lifestyle does not work for everyone. So it really has to be a tailored approach to what fits your needs and your goals. So what I want to work on with you is improving your overall health, your nutrition, and your weight management. And that is not going on a diet.